Hello, this is Dr. Hausinger, and we're going to be going over state, federal codes, laws, and ethics for what you need to know regarding chemical dependency or substance use disorder. So, first off, in the state of Washington, how does one become a chemical dependency professional? We're going to be changing this here, so now the language is going to be substance use disorder professional, but like anything, it's going to take a little while. They just officially voted on that a couple months ago in April, so you're going to be seeing that change. Okay, so it takes up about 2 years, and the number of hours that you will be required to work under your credential depends upon the level of degree that you hold. So the first thing is you have to complete your coursework. So a degree or 90 college credits, and they're debating on what to doing with that because I don't know any place that will hire you as a counselor unless you have a degree. Okay. Now, at the semester system, which we're in, you need 30 credits in city-specific topics. If you were a quarter system, you need 45. Okay, so all of you can do this right now. You can go to the Department of Health and register for the CDPT credential. The minute that you do, that's when the clock starts ticking, and you have 5 years to get from here to here. So you have 5 years to finish all your classes and get all your work experience. Once you are a CDPT, or it's going to be SUDT now, then you can get your clinical hours, and it's usually a job. So you might not get paid for the first 50 hours. I know some places that do like a year-long internship and they don't pay you until you have 1,000 hours. I wouldn't necessarily recommend that because this is a job that you can get paid for. A CDPT is a job, as is CDP, and nobody expects you to work for free. But the first 50 hours, it would be a good idea to use your internship for that because the first 50 hours, you have to be supervised all the time. You can't be left alone with clients. You can't do your own assessments. And really, that's just a week and 10 hours of full-time work, not even a week and a half. Okay. But then after that, then you can start having your own clients and stuff like that. Okay. So at the bachelor's level, you need 2,000 hours as a CDPT. And then afterwards, you turn in your application to the Department of Health. If you have a criminal record, then you have to submit it on paper. If you don't, then you can submit it online. And having a record does not disclude you automatically from doing this. CD is a very forgiving field, and in general, you're going to be able to see that you're gonna see a lot of people with pasts, which is okay. So if you have something on your record, don't automatically panic. There's nothing that says if you have this, you can't be a CDP. Okay. Now, the DSHS secretary, if you want to work for the state, then there is a list of the secretary's list of lifetime bans and 5-year bans. So, for example, if you ever have had a murder charge, then you can't work for CPS. I hope that makes sense to you. But let's look at the 5-year bans. So if you had a DV charge, an assault charge that wasn't domestic violence against a partner or a child, let's say that you got into a bar fight or something, right? If it's been 5 years and they investigate it, then you might be able to, work for a state agency with vulnerable populations. So don't rule anything out. It used to be that the exam was only offered at certain times. You can have an on-demand exam, and the state accepts a couple different exams. The one that most people take is the NADEC exam, and it's 200 multiple choice questions in 3 hours. And then if you pass that, then you are a CDP, and the credential expires every year on your birthday. It is now about $300. When you are a CDPT, it's about $90 to $110, and it expires from when you get it. So today is July 7th. If you were to get it today, it would expire next year. But if your birthday is, let's say, August 1st, then you would have to pay for both the CDPT and your CDP credential because you have to prepay for that. Okay. Now, once you become a CDP every 2 years, then you have to do continuing education requirements, and it's 40 hours, which isn't a lot, and a lot of times your agency can pay for that. And what it's going to do is you have to take certain amount of hours in ethics and diversity and multiculturalism and a couple other things, and then the rest you can do yourself. If you do join the NADAC, which is inexpensive for students, then you can get discounted webinars and CEUs online. So a lot of the CEUs you can get online. Okay. Ethics versus the law. Let's go over some definitions. Ethics are generally regarded as the standards that govern the conduct of a person. Smith and Hodges define ethics as a human reflecting self-consciously on the act of being a moral being. This implies a process of self-reflection and awareness of how to behave as a moral being. Some definitions are dictated by law, individual belief systems, religion, or a mixture of all three. That's from the NADAC. A law, a binding custom or practice of a community, a rule of conduct or action prescribed or formally recognized as binding or enforced by a controlling authority. 2, the whole body of such customs, practices, or rules the courts exist to uphold, interpret, and apply the law. 3, common law. Or B, the control brought about by the existence or enforcement of such law, preserved law and order in the town. 2, the action of laws considered as a means of redressing wrongs. Professionalism are the conduct, aims, or qualities that characterize or mark a profession or professional person. Okay, so the law is the minimum standard of what we have to do. So, for example, we are required by law to wear seatbelts and to stop at stop signs and red lights. Okay. Now, what is legal is not always ethical. What is ethical is not always legal. And you can be legal and ethical and be unprofessional. So, for example, if I decided that I was just going to wear a bikini all the time and teach my classes in a bikini and be a CD counselor in a bikini, or even better, if I decided that I wanted to wear this Stephen King It costume and that was my new wardrobe, it's not illegal. It's not unethical. It's highly unprofessional and probably pretty creepy. And you might question my ability to counsel you or to teach you. Okay. So in other words, ethics are what is right to do. It's to do with moral codes. And remember that this is going to change based off of where you are culturally and geographically. Law, what I have to do, and professionalism, how I should act as a professional. Okay. So for example, let's say that you have a client who is at a homeless shelter and they have court visitation with their children and they are out of bus money. And if they do not get on the bus and visit their kids, then they're going to get in trouble and be penalized for missing a visit. You decide to give them $3 of your own money for the bus. Okay. So there's no law about that. Okay. Ethics, that might be the right thing to do. Your agency might have rules against that. Okay. But you have to make a choice. Okay. So let's look at the NADAC, which is the Association for Addiction Professionals, and they changed their name, but you still see the NADAC there. They were founded in 1972 as the National Association of Alcoholism Counselors and Trainers. The organization's primary objective was to develop a field of professional counselors with professional qualifications and backgrounds. The organization evolved and became the National Association for Alcoholism and Drug Abuse Counselors in 1982, uniting professionals who worked for positive outcomes in alcohol and drug services. NADAC's new name, NADAC, the Association for Addiction Professionals, was adopted in 2001 and reflects the increasing variety of addiction services professionals, counselors, administrators, social workers, and others who are active in counseling, prevention, intervention, treatment, education, and research. The NADAC NCCAP Code of Ethics was written to govern the conduct of NADAC's members, and it is the accepted standard of conduct for addiction professionals certified by the National Certification Commission for Addiction Professionals. The Code of Ethics reflects ideals of NADAC and its members and is designed as a statement of the values of the profession and as a guide for making clinical decisions. And I encourage you to go and look at this website. It is posted in your Moodle module for this week. When you go to the website, you're going to see that these are the principles, and under each of them, there are more bullet points that you can read about. So NADAC is going to give you information about how to act as a professional in regards to these categories: the counseling relationship, confidentiality, and privileged communication. Here we have the intersection between law, ethics, and professionalism. Okay, we do have laws about confidentiality, professional responsibilities and workplace standards, working in a culturally diverse world, assessment, evaluation, and interpretation, e-therapy, e-supervision, and social media, supervision and consultation, resolving ethical concerns, and research and publication. Okay. So this is definitely a political cartoon here. And here is where you can find what we're going to be going over next at SAMHSA. Okay. So we're going to be looking at some of the very important acts and policies and laws here. The Affordable Care Act of 2010 is one aspect of a broader movement towards reforming the healthcare system. The Affordable Care Act makes health insurance more affordable for individuals, families, and small business owners. People living with mental health challenges or substance use disorders often have problems getting private health insurance. Now there are insurance protections to help. So basically, this is for private and public. They have to cover some type of substance abuse recovery and mental health treatment by law. They have to. So before, public health insurance wasn't mandated to do that, or some of the insurances that people bought weren't mandated to do that, and now they are, which is good. So you can go to treatment on state medical and Medicare and Medicaid. Okay, so we have the American with Disabilities Act, the ADA. It establishes requirements for equal opportunities in employment, state and local government services, public accommodations, commercial facilities, transportation, and telecommunications for citizens with disabilities, including people with mental illnesses and addictions. So it is covered. Now, what this really helps with is employment. Okay, so if a person gets written up, let's say that the person works with Boeing. Okay, Boeing has a great EAP program, Employee Assistance Program. The person is written up for tardiness or absences, suspected substance abuse. They talk to their EAP, which is through HR, and a lot of employers have this. And it's good. It's basically you can get free services and free counseling just for working at a place. And I think that they're definitely underutilized. So if you have one, I would definitely look into it. It can help with FMLA, grief counseling, a lot of different things. It's a good thing. Okay, so let's say a person's been getting written up at Boeing. They go to their EAP and disclose that they're struggling with substances. Okay, the EAP can advocate to the insurance company and say, this person, in order to keep their job, has to go to treatment. And this is our recommendation. You have to authorize the treatment because it is now covered under the ADA. That wasn't previously across the board, so now we have more people having access to treatment. The Mental Health Parity and Addiction Equity Act of 2008 requires insurance groups offering coverage for mental health or substance use disorders to take these benefits comparable to general medical coverage. Deductibles, copays, out-of-pocket maximums, treatment limitations, etc. for mental health or substance use disorders must be no more restrictive than the same requirements or benefits offered for other medical care. So this is a very important act as well. As we would see that things were very, very hackneyed and off kilter with people not being able to get enough treatment. And they're like, nope, if this is, we have to, if we're saying that it's a disease, and if we're saying that mental health and addiction are just like other medical conditions, then we have to treat them as such. Okay. So let's look now at federal regulations. Federal regulations apply to states, local governments, and religious organizations that receive substance abuse prevention and treatment block grants or projects for the assistance in the transition from homelessness, formula grants, or both. The following federal regulations apply to states, local governments, and religious organizations that receive discretionary funding to pay for substance use prevention and treatment services. Okay, so basically, we can get money from the government for treatment, for homelessness, and it can be for state, local governments, religious organizations, but they just don't give us money. They have to know where it's going and what we're doing with it. So when looking at this, we're going to go back to the SAMHSA page, and I'm going to skip ahead a little bit, but this is going to cover some of the provisions for school funding, projects, etc. Okay. So we're just going to switch gears for a second. The WAC, the Washington Administrative Code. I have the links here for all the ones that are important for you to know. A rule, or Washington Administrative Code, is written to provide interpretive support for the individuals or entities to whom the rule applies. Department of Health rules are written and adopted by a board or commission or the Secretary of the Department of Health. Rules or WACs carry the full force of the laws. So, last year, July 2018, the purveyance of CD went from DSHS to DOH. So a lot of the WAC was rewritten, and what's nice about this is that it's pretty much all in this chapter now instead of having to go find it, and you do have that in your Moodle module as well. So the CD requirements for agency and individual are here. The administrative procedures and requirements for credentialed healthcare providers are here. So you're going to see a lot of the CD stuff that has now been translated over to behavioral health, not just by itself. Whistleblower procedures, so you see something that's happening that's illegal or questionable or ethical, unethical, what can you do? These are the standards of professional conduct that all healthcare providers have to follow in Washington. Okay, now we have the RCW. What is an RCW? It's a statute or revised code of Washington, and it's written by the Washington State Legislature. Once legislation is signed by the governor, it becomes law. So they are similar to the WAC. You're going to see some crossovers. 18.205, chemical dependency professionals. I encourage you to look at this one above everything else. Rebating by health professionals. So how do we give our clients rebates in a professionally ethical way? This provides a flow chart of if you get in trouble, what does that look like, the due process. And then here we have mandated reporting, and we have a separate section for individuals as well, vulnerable individuals. Okay. One of the most important federal regulations, CFR 42, covers patient confidentiality. Part 2, confidentiality of substance use disorder patient records. This details patient record confidentiality and how to safely and ethically handle patient records. And they recently expanded it about a year or so ago to include electronic records. And here is the direct link for that. I would like you to go and look at that. More important RCWs, Administrative Procedures Acts, our Public Records Acts, what is public and how can I request something, medical records, healthcare information access and disclosure. Here we have something more to do with mandated reporting, the abuse of vulnerable adults, and then prescription monitoring, which we do talk about in 402. This is how our state handles it. Okay. So, ethical versus legal. I want you to think about some of these questions, and we can discuss these questions. Why did you get into this profession? Who are you really good at helping? Who are you not so good at helping? Who is your professional hero and why? Who is your fallen hero and why? So this doesn't mean somebody that's necessarily deceased. It means maybe somebody that looked up to you and became disgraced or failed you in some way. And then how do you describe the culture in your family growing up? What was valued in your family? And we're going to discuss these questions this week on our Voxer. Okay, so if you want more information, you can go right to the DOH website. And then you can go to dshs.wa.gov.dasa for more information on behavioral health and recovery.